So let's check up if you hear me or not. Do you hear me well? Not through the phone, but through the computer?
Yeah, I can hear you.
Amazing. Okay, so I wouldn't see even icons of my precious colleagues. It's a pity. Okay. Uh, I would much appreciate if you let me know when I can start, because I prepare some interesting material for you, my dear colleagues. I can hear you loud and clear. Amazing. I will switch off my mobile because exactly at this moment, everyone would like to call me, for sure. Mhm. I can hear you, but my camera won't go on. Okay, my dear colleagues, Holly, please let me know when I can start because I understand how pressure, uh, how valuable the time of my colleagues. So I'm feel free to start now. So I thank you very much. The only problem that when I start and as far as I understand, when I switch on my presentation, I wouldn't be able to see your questions or comments. And to be able to see it, I think I must switch to the question mode again. So in case I need to do this, please let me know probably by giving me a small call. The host can turn on the video image. Okay, okay. So uh, let me know. It's a pity that I don't see any questions because you cannot let me know what is going on behind in case something happened. Uh, if you can somehow to put the questions above my presentations, please do it. For me, it will be pleasure to have an exchange with auditorium because I wanted to share with you, to discuss with you some things as well. So, my dearest colleagues, first of all, I would like to thank you, everyone, to thank every one of you to join this webinar, that you take your time to come today. I know that you have been informed in a very short period, and you probably need to cancel some of your professional activity, and I do thank you for that. My name is Dr. Yelena Rumyantseva, dermatologist, dermatosurgeon, and aesthetic doctor since more than 23 years. And I think more than 16 years of my practice, I'm using amino acid replacement therapy, which allows me to have very high standards in my practice. I'm a lecturer in French University for postgraduate education. I did sorry in advance for my English, which is really Franglish already. So if you don't understand something, please don't hesitate to ask me. I'm also a scientific director of International Medical Academy. This is independent training center located in different countries, but the main office are located in Prague in Czech Republic. We will be happy together with our host today to invite you there one day to provide you even more practical knowledges for different kind of aesthetic treatments. We do conduct workshops and congresses, everything for your best practice. Just let you know that today we would like to talk about, we have just 1 hour, right now probably 55 minutes, and we're supposed to talk about some very important things. We don't want, and the majority of questions, we don't talk anymore about anti-aging, we call about pro-aging because we cannot live longer without getting older, but we don't want to fight with the aging process. We would like to go through the aging process and to make it the most successful, to normalize the speed of aging process, because in majority of cases, unfortunately, this process is just the speed of this process is too high due to all aggressive circumstances. And today specifically, I would like to talk about high a level of importance of amino acid replacement therapy. Why? Because basically all of us, all our body contains the target for this process. And in case before we were talking about aging of the uh, organism in global, and we were talking about aging of the skin right now, we don't talk about the particular organs. We speak mostly about connective tissue. Why? Because connective tissue and the aging process of connective tissue is equal to the aging process of all our body. And basically, I'm sorry, this is not, I have some, okay, yeah. So sorry for that. Yeah, and why the process is so important? Because connective tissue, this is the one of the main tissue in our body which contains fibers, ground substance, and cells, and we don't have any organ which doesn't contain connective tissue. Even if a static practice, we mostly work with the face or with the skin, or sometimes we go even deeper. Basically, we work mostly with connective tissue. That's why it's so important to understand where connective tissue is located, from what components it contains and consist, and how to support it before connective tissue degrade in our body. And why the state of connective tissue is so important, you will understand just after this simple example. Can you please let me know? Here I would like to see your answers. But how often in your practice do you do lips? I think I don't see your answers for the moment. I will try to check up if I can see your answers. Hello to everyone who joined our webinar. In case you can just raise your hand, it will be welcome. I would like to know how many of you use lip treatment in your practice. I think everyone, right? I mean, at least once a day, this is the minimum your patients ask you to inject lips. So do I. Yes, often, very often. And I give you this simple example. So this lady, she came to me uh, and she asked me to do lip augmentation. But when I evaluate her skin. Her skin was very loose. You know, it's like you have a lot of empty space inside. And what I told her, please, the lip augmentation, this is not what you should do at first place. You should improve the state of your skin, the state of basically connective tissue, to avoid any problems, to avoid the displacement of the filler, to avoid creation of bubbles or kind of unevenness. This patient, she has, we're going to talk about it later, but I think you know about it. Please let me know, have you ever heard about connective tissue dysplasia in your practice? Please write down in the comments, do you know about this? Should I talk about it more? But anyhow, this I see, because of the quality of her connective tissue, that he has a problem with her connective tissue. She didn't listen me, and she went to another specialist who made lips for her. In a time, she come back and she showed me these bumps and lumps. Said, Yelena, you were right. Even the filler was good, even the specialist was okay. And technique she used was okay, but she got these bumps and lumps. Why? Because the state of her connective tissue was too weak, and the mimic active muscle, orbicularis oris, made this displacement of the filler. Of what I did, I removed it, of course, with hyaluronidase. Then I treated her lips with amino acid replacement therapy to improve the state of her connective tissue, and then I inject filler with a good result. Another problem with connective tissue, and why I give you lips as an example, because basically this is what we see a lot in our practice. And I just would like to let you know that on the left you have one patient, you see one patient, and two other pictures in the center on the right. This is another patient. And in both cases, you see that there is a displacement of the filler. And this patient on the left, she has a good state of connective tissue. And this patient on the right, she has a bad state of connective tissue. It means a lot of biopolymers, especially if it's volumetric biopolymers like hyaluronic acid, will create edema in her face, or they might migrate. What happened here? Basically, she did a filler in her lips. Here, there is no problem. She just was overcorrected. But for this lady, why I tell you this? This lady, she got injection 2 years ago. And then, no, she did about 3 years ago. But then during 2 years, her connective tissue became very weak because of one very important process. Everybody of you aware about this process. I will let you 1 minute to guess. How do you think what happened with her? What kind of process create the problem in this patient? Why her connective tissue become very weak? First problem which can bring to this problem, this is a stress, but it should be very intensive and long-lasting stress. In her case, I don't know if anyone guess what happened. I will give you directly the answer. Basically, she became vegetarian for 2 years, but she became not even vegetarian like, but kind of vegan, like zero animal protein for more than 2 years. And then she didn't compensate her new lifestyle somehow. So she had not only protein deficiency, but also a lot of other deficiencies. And she came to me with this displacement of the filler inside the lips, asking Yelena, what is going on with me? I don't know, my body is changing, skin is very loose, and look what is happening with my lips. And then I started to question her, and we discovered the situation. For the moment, she's not vegetarian anymore, but due to the degradation of connective tissue inside the skin, she got displacement of this filler. And why basically she lose a lot of connective tissue in her face and the quality of the skin, because her body was lacking of the protein. And where body took the protein, where was the source of the protein? Of course, it was the skin and connective tissue of the face all over the body, but it was seen on the face, and filler moved down. You might think that this is the kind of catastrophe, but everything is okay. I removed the filler. I did amino acid replacement therapy, and this is her lip before the injection of the filler. And this is how she went to see me several days ago, and we make augmentation of the filler step by step. And in this case, because she got proper preparation of her connective tissue, this result gonna last long, and it won't create any kind of problem for her. And what I mean by connective tissue improvement, what I mean by amino acid replacement therapy, I'm sure that all of you are familiar with Jello Pro products, and I'll show you some articles which proves that injection in perioral area really brings a lot of results. Colleague of mine from Italy, Dr. Poliva, she proved it, and she made a publication 1 year ago. You see the changes dramatically, great changes before and after injection of several times of GeloPro HMW. This is my favorite product. One of my favorite products in the practice, but all products are really doing great. This product she used to work with this lady. And here I would like to show you the just short video. This video has been provided to me by my precious colleague, Dr. Evgenia Shelemba. Probably you have seen it already. And this is how we make injection inside the lips. My main message, we're going to talk a lot about science, but to attract your attention, I would like to show you some practical things right away. So to be able to improve the state of your lips after resorption of hyaluronic acid, cross-linked hyaluronic acid, before to make a new injection of the filler, I do advise you to restore connective tissue, and this is the best way how to do it. You can use the technique you would like, but this technique allows you to improve the state of the lip. Even if your patient don't want to re-inject a filler, or they came without demand to improve the filler, the lips with the filler, you still can offer GeloPro HMW as a refreshment, as an improvement of the state of the lips. Please remember that the lips, this is not only the red part, it's also the white part, everything which is located between nose and the menton. So we inject in red part and we re-inject all over the area. Why? Because we must protect connective tissue, and thanks to that, we will keep the fat compartments of the place, and we will step by step prevent degradation of fat compartments which are located in this area. Injections are not very painful. Of course, I do it after local anesthesia. Normally, I use for this kind of procedures 10% or 20% lidocaine cream for short application for a short period of time, and then just re-inject. So nothing technique is not difficult at all. Beginners can do it very easily. So there is one more case which we did with colleagues of mine from International Medical Academy, Dr. Molnar. This was the filler. Then we dissolve it with hyaluronidase when we use GeloPro to improve the state of the tissue, and then injection of filler give us amazing result. So nobody talk about the proper state of connective tissue. Everyone just say inject hydroxyapatite of calcium, inject polylactic acid, do hyaluronic acid fillers, but the result, the final result will really depend on the state of connective tissue. Before I switch to another topic, I would like to talk about just a little bit about vegetarian patient in common. I switched to comments because I need to be interactive. I cannot just make a, it's a little bit strange for me to talk to just to myself. I need your voices. I'm not sure okay. Okay. Could you please let me know, do you have vegetarian Do you have vegetarian patients? Because here in Paris, where I practice, and in my partner's clinics in Prague, there are a lot of vegetarian patients, and a lot of them don't respect the rules of yes, I have just 2 years from 23 people who join our webinar. I'm sure you're supposed to have a lot. My question is, are you by yourself a vegetarian? Even if you use in your daily meal, you use animal protein, we must remember that starting from 35, and I don't see your faces. If I would see, I'm sure I couldn't guess your age, because surely all of you look gorgeous, but still, in case your age above than 35, like mine, unfortunately, we have already the problem with digestion. The level of acidity in our digestive system is decreasing, and because of that, the degradation of uh, protein in digestive system is low, so absorption level is not very good. So even if we are not consider ourselves as a vegetarians, we became, me and my patients and your patients, and unfortunately you by yourself, after 35, we become undesired vegetarians. I don't know if you ever heard about it, if you ever heard uh, this terminology, but this is what we start to discuss with my colleagues, I think several years ago, that people, even the people and the patients who on daily basis consume protein and animal protein particularly, they still cannot absorb it properly. And to be able to absorb it properly, we should have either pure amino acids, either high level and great level of work of digestive system, which is not the case, unfortunately, in all big cities. Possible problems which people who people who don't consume animal protein, they can have. I give you a list in case you're interested in this question. You can ask me questions after. But look, at first place, the biggest problem, this is the protein deficiency. And even if these patients will try to support the level of protein consumption by plant protein, sometimes it's not enough. We still can check up it by blood test, but on daily basis, not a lot of specialists prescribe blood tests before to do any aesthetic procedures. That's why before any kind of aesthetic treatment, lasers, stimulation of the collagen, threads, I mean, by lasers, I mean all energy-based devices where you stimulate before injection of hyaluronic acid, basically before everything, even before the injection of botulinum toxin, because with the age we lose the quality of the skin and subcutaneous tissue, we must provide to our skin and to our subcutaneous tissue great support with amino acids. So first, my message, home take message, don't hesitate inside your blood test to check up the level of the protein. Don't forget time to time to check up the level of deficiency, which might occur even if your patient is not vegetarian. Check up these deficiencies or excessive consumptions of some ingredients in the lifestyle of the patient. So coming back to connective tissue, in case, by the way, in case you have any questions about this information, once again, don't hesitate to tell me. About the connective tissue in global, one of the main component of connective tissue, here we come to the state which is more or less which you already know, well known for you. So you know that the connective tissue contain a lot of collagen. Globally in our body, we have a lot of types of collagen, but when we come to the skin and the subcutaneous tissue, we normally talk about collagen type 1. Here on this slide, I would like to draw your attention to one more important type of the collagen, which is collagen type 3. This collagen is mainly located between upper and deep layer of the skin, between epidermis and real dermis. And this is the main collagen of the basal membrane, and including collagen type 4. And why we have to know about this collagen as well, because of the state with which our patients coming to us right now. After summer, your patients might have a lot of hyperpigmentation. And when you see this kind of problem, please remember always before to give the sun on just after, don't hesitate to offer to your patient biorevitalization based on hyaluronic acid and amino acids to be able to improve the state of collagen type 1, type 3, and type 4, because all these collagen will help to heal the whole dermis and to prevent the pigment to go down. It means that hyperpigmentation for your patient will be treated in the future much more easier. So this is also very important factor. With which cells we're gonna work? We're gonna work with two types of cells. This is a fibroblast, and they are close brothers, they're cousins, which are located down to the skin. These are tenocytes. I'm sure that you're familiar with these nice cells as well. They undergo absolutely for the same rules as a fibroblast. You can stimulate them by injection of collagen stimulators, by high level of amino acids, by temperature, or by trauma caused by energy-based diseases. Second component of connective tissue, this is the elastin. And you remember that elastin and collagen, they contain slightly different sequence of amino acids, so they are not the same. Elastin contain valine and alanine, and when you check up which product should be injected on which level, please remember to read the ingredients and locate it properly. I'm gonna provide to you the special picture which will allow you to remember it easily. Inside connective tissue, we have so-called ground substance, which is on the level of skin presented by extracellular matrix. This is a very important part of the pro-aging process. We must keep extracellular matrix, or in case we talk about the whole 3D structure of the skin, we must keep ground substance in a well state. How to do it? It's not very difficult to do it in case you use a proper product. This is, you must just rejuvenate. You just should put the cells which creates collagen and extracellular matrix in the best conditions, and the best conditions for them are the high level of amino acids and a proper amount of hyaluronic acid. Thanks to these proper surroundings, cells become younger and they produce younger collagen and beta elastin, and this is why, and we have a proper product for that, and this is why we should do it in advance. So before cells become older, don't forget to feed to inject inside extracellular matrix the proper ingredients so cells become younger, and then they provide younger structures. I would like to remind you as well the structure of the face. I'm sure you already saw this picture several times. I do like to show it to my patients. My patients call it crocodile picture, and this is a picture which allows my patient to explain how it's important to not only treat the skin, not only creams or superficial treatment will provide result, but it's also very important to keep these small fibers, which is actually the connective tissue, in a healthy state, to keep them strong. And this type of treatment, which maintain all these fibers, will help to prevent, reduce or prevent the ptosis, the movement of the tissue down. And the good news is that all these fibers by the way, on these fibers, you will see these small and lovely tenocytes, the close relatives of the fibroblasts, which are located in the skin. And these tenocytes, in case we feed them properly, will help us to maintain ligaments and fibers of connective tissue. The good news is that the main collagen inside all these fibers, this is a collagen type 1, and we already know the perfect amino acid structure to amino acid sequence and the amount of amino acids to maintain this kind of collagen. And this is the amino acid cluster, which has been invented many years ago. Let me show you the products. This is the first product which I met in my practice many years ago, and exactly this product helps to help me to understand how it's important to support the collagen first in the skin, how to treat atrophic scars. I'm sure all of you familiar with it. So inside this product, you have the proper amino acid cluster to support the collagen type 1 intradermally, and then in other products we can use we can use it to support the deeper construction. When you talk to your patient, never forget to explain that it's very important not only to treat, but also to prevent the aging process. Why? Because the older connective tissue, the older the ligaments, then the less efficient our treatment might be. So it's always better to start to treat the skin and subcutaneous tissue, which all is connective tissue, before the problem starts. And that's why we have so wide range of amino acid replacement therapy to provide to your patients the best outcome. On our face, we have skin all over the area. Between the skin, I also like to show to my patient, we have a lot of fibers, and some of these fibers, they are really located close to each other. So connective tissue is very dense, and these dense spaces, they called ligaments. And you see, it might be ligaments, it might be septum, depending on the 3D structure of this dense connective tissue. But you see how many of structures we have on the face, and by maintaining the proper structure of this anatomical by maintaining the proper state of these anatomical structures, we are able to improve the state of the face of in very natural and very physiological way. by keeping connective tissue on the same place, we also help to fat to be to stay in the place where it should stay, and we prevent the degradation of the fat and changing of the state of the fat, because in a time with the aging process, fat become also very loose because connective tissue becomes it starts to collect more water. Why? Because lymph drainage system is also lacking of the structure of the strength, and then we don't have enough microcirculation. So the best what we can do for connective tissue is just to continuously maintain amount of amino acid injected or provided orally to be able to keep the best state of the skin. About 40% of the people in our population, they have problems with the creation of the collagen, genetic problems of creation of the collagen. And these types of patients, we call it patients with minor connective tissue disorders or patients with connective tissue dysplasia. I don't want to stay on this slide for a long time. I just would like to remind you that there are a lot of problems which we face every day, me and you, which destroy the collagen or increase the level of destruction of the collagen or connective tissue. And some of our patients, they're predisposed to this destruction by genetics. And these kind of patients, they have much elastic ligaments. Their face is very elastic. They at their young age, like being 30s, they already the face which might look like 35 or 40 or even more like tight face. And patient who has this kind of genetics, they should not only treat their skin connective tissue, they should get support by vitamins, they should clear up their lifestyle. Once you would like to know about it, then I will be happy to provide you these knowledges. Probably once I come next week to Great Britain, I will be happy to answer your question or I'll share with you my algorithm of treatment. But this is for sure, these patients, they almost permanently supply with amino acids, proper amino acids, which has never been in animal. They have been created in the lab. I'm sure all of you familiar with this product. This is the Jaloprodin or Jalopro tablets. I'm going to show it to you. These are like my favorite products. These products which help me to my patients with vitamin C amino acids in liquid form and amino acids in compressed powder. These are not tablets. This is a compressed powder which contains also vitamin C. These products help to improve the internal state, and these patients, they should have long courses of amino acid, oral amino acid replacement therapy. This patient, they might show to you, you can easily recognize them by benign joint hypermobility syndrome, as I showed you on the video. And these kind of patients requires much more treatments of amino acid replacement therapy compared with normal patients. I quickly switch to our auditorium. I would like to check up if you have any question. And you see that you cannot see slides. Can you only see the vegetable? Okay.
Elena, we could see the slides, but it was just stuck on the vegetarian one.
People told me that they don't see the slides which moves. Okay. How can we correct this? can I ask technical support to help me? Because I thought that you can see algorithms of treatment, but basically you cannot. Probably you can share, you can help me. Can we see them? You just need to ensure you are changing them. Yes, this is what I do. I changing them, but do you see how I change it or not? It seems like we can see, because I saw some people, they say that they don't see it. Okay. Oh, then you see it, and I think I can continue. I will be happy to share some of them with you without any problem. It's just I would like to give you algorithms of treatment as well. It will be my pleasure to do it. And can you please let me know if you see right now what I'm showing to you? This is the main products which we use for amino acid therapy, and on daily basis I use it in my practice. And I just would like quickly to go through the products and to underline you the importance of these products in your practice and how to distinguish one product from another. The classical product, which is Jalapro Classic, it contains amino acid cluster and low molecular weight hyaluronic acid. This product help you to work with periorbital area, with the early aging of this area, with the body treatment, with the face, with preliminary to edema, with oily skin, and as I told you already, with a wide area. Because inside this product you have treatment, 2 treatments. Each contains 3 ml of cocktail, and it's very easy to prepare it just before injection. Second product, where the classic amino acid cluster is absolutely the same as in Jalapro Classic. This is a Jalapro HMW. The only difference, this is the molecular weight of hyaluronic acid and also the concentration itself. So please remember about it. And this product I mostly use for the face and neck treatment at the same time. It made the lip rejuvenation, and as I showed to you, neck or décolleté. And I do like the protocol which calls 5.5. When I mix the both products together in one syringe, so I got 3 ml from Jalapro Classic, 2.5 ml from Jalapro HMW. I mixed it together, and this treatment helps me to work to go through the face, neck, and décolleté. And this mixture helped me to prevent any post-treatment edema, and to work with a combination of both products allows me to provide to my patients 2 types of hyaluronic acid, which work on different levels and with different receptors. The classical product help us to understand and prepare the attention of my patient to Jalapro Super Hydra. This product was like the boom 2 years ago. It helps us all and to helps to our patient to understand the importance of the treatment of connective tissue. We went deeper, we went through the skin down to the skin. And basically, this is the first and unique product which helps to maintain the health state of tenocytes, the cell of connective tissue. This product can be combined easily with both products which I mentioned above, and depending on the state of connective tissue of the patient, you can combine it with during all 4 procedures, or you can start from one treatment and then switch to Jalapro Super Hydra. Here you can see the short description of what you have inside and the basic courses. But in case, for instance, you work with vegetarian patient, always don't hesitate to add 2 more courses. And of course, don't hesitate to work and to offer to your patients amino acid replacement therapy orally. Amino acids must be taken in the morning before the main meal. First, when your patients wake up, we advise to drink warm water with a bit of lemon juice. In case of Jalopro vitamin C, you don't need to add lemon juice because it already contains vitamin C. In case of drinkable amino acid, they do advise to do it, and don't hesitate to use at least glass of warm water to work with these products. And about Jalopro vitamin C, these are not tablets. You don't need to swallow it. You put it inside the water, or small shaker, small bottle with water. You shake it, and then you're supposed to drink it before the meal for the better absorption of amino acids. So please remember, this is the proper time to take, and these are 2 forms which are best absorbed in the body of your patients. And here you see the slide, which helps you to understand the level of injection. So at this very same procedure, we can work on the deep layers to improve the state of connective tissue, state of collagen and elastin. And at the very same procedure, I do like to do for the oily skin Jalopro Classic, or for the skin or for the face with predisposition of edema inside intradermally Jalopro Classic, and for the dry skin, this is a perfect combination to work with. So don't hesitate to knowing how concentration of the product works, to combine it during the same procedure, and you will get amazing results. Don't forget that this product particularly contains high level of hyaluronic acid. This is a 3.2, as you see right on the package, so you will never forget it. And there are 2 types of hyaluronic acid inside. That's why you will have longer lasting depot, or where you have inject the product, and small bump can stay sometimes up to 48 hours. It's absolutely normal, and thanks to peptides which contain this product and which blocks activity of hyaluronidase, the depot of amino acids and hyaluronic acid lasts even longer. Thanks to the scientific study which has been done by Dr. Shalemba, we create a protocol together with Evgenia, and she used the Dermalab Combo analyzer to understand what is going on after injection of Jalopro Superhydro. And here you see the results. You see the dramatical improvement of the dense of the collagen and elastin. You see the improvement of the thickness of the skin and cells and connective tissue after 3 injection of Jalopro Superhydro. And the last product about which I would like to talk today, this is the newborn in the family of Jalopro. This is the Jalopro Young Eye. We looked for these products since a very several years. We tested with my colleagues several formulas, and this is the most successful product for the moment for the periorbital treatment. These products contain peptides, amino acids, and 2 different types of hyaluronic acid. The only concern, please don't use this product in case the main problem for the patient, this is edema. As this product has been done to improve the state of the skin itself, the state of connective tissue. It means all these small fibers which are located down to the skin. But to be able to do that, we must provide amino acids and hyaluronic acids to keep them working, and peptides all together. And of course, it gives slight post-procedure edema and fill up the area. So in case of predisposition to edema in periorbital area, this is not just the proper indication for this patient. And in case, but these kind of patients, anyhow, they require other types of treatments. And in case of tight skin, in case of thin skin, dry skin, in case of having the loose skin in periorbital area, this is one of the perfect treatment to work with. And also don't hesitate to work not only with the low eyelid, upper eyelid, the whole crown feet area, and also this is a very important indication. Never forget to treat the area just above the eyebrows. This is one of my favorite treatments for the moment for the upper part and middle part of the face, and especially for the patient who concerned about atrophy of the skin in the forehead area. This is a very interesting demand, and coming to UK, I will show you the technique which will allow you to improve the state of this area of the face and to improve the outcome after the botulinum toxin injection. And protocol is absolutely easy. I mostly advise always 4 injection, less time free, because you see how you want to see by yourself how skin is improved. In time between injection, it's mostly 2 weeks because drainage is not very quick, unfortunately, in majority of patients with the age from starting from 35. And I do advise you to use a really small needle to prevent the bruising. So patient will come with a more desire to repeat this procedure again. In case you have questions, don't hesitate to WhatsApp me or put the questions in the chat. I'm coming back to our teams to answer your questions. Will YaluPro help with the loose skin of the neck? Sure, especially. Okay, you will send it. It's great. So for according to the neck, yes, this is a great treatment. I do like to combine YaluPro depending on the state. Those two products is YaluPro HMW and YaluPro Super Hydro. These are best product for the neck. In case you need quick hydration and patient cannot allow to come every 2 weeks, the choice is YaluPro Super Hydro. And in case you see the loose connective tissue, so when you see a lot of wrinkles, in case of the dry skin, always use HMW. About Jalubotox, we have a special video which has been recorded how we do it. Of course, the Jalutoxin, this is one of the most interesting procedure in the practice, but I use it just with YaluPro Classic. And for the neck area, I would use the same amount of toxin which I can use for the mono injection by itself. But normally for the neck, it can go between 12 and 20 units if I count in Allergan units, and it can be up to 50 in case I talk about Spain. I can provide you with the algorithm of mixture as well, what the depth to do if mix HMW and Super Hydro deep under the skin and HMW intradermally. And never forget what to do first. First, we improve the state of connective tissue, so deep Super Hydro, and I like to use needle 2713, so short one, not 4 mm, but 13, to introduce this product. So first we treat deep connective tissue, and then we do intradermal introduction of GelluPro HMW or GelluPro Classic. Okay, the slides and the protocol for all 4 types of gel. Yes, I mean, of course, you can have all protocols. There is a new brochure in English. I have seen it where you can have all information already written. This is here. There is no problem for that. I would like to ask, in case I missed some questions, because I was on my slides, I hope you see them. I just would like to ask the help of Holly to resend it to me again. Okay, PowerPoint. It seems like I answer all questions. Okay, you can clarify the test. Can you clarify what tests you order in being vegetarian conversion? There are some questions which are linked to the vegetarian state of the patients. Of course, I can provide you the algorithm of the research which I used to do for my patients, especially before I start to work with collagen stimulators. And I would like to thank GelluPro that they exist on the market, because there are a lot of patients, they are coming to me to make polylactic acid or hydroxyapatite of calcium, and then I see their preliminary state. I said, no, guys, first we will do preparation of your connective tissue. Of course, I tell them this on their language. I tell that we're gonna inject a special product to feed your cells. And during this time, it takes around 1.5 months up to 2 months when I prepare the skin, when I do GelluPro HMW or GelluPro Super Hydro. I have time to also check up on their blood tests and correct deficiencies. So the outcome after laser, after all stimulation, like collagen stimulators, as I told you, like polylactic acid or hydroxyapatite of calcium, give me the best outcome. So my patients are always satisfied because it helps me to have a global approach. So thanks to GelluPro and amino acid replacement therapy, you're gonna have best outcomes after every aesthetic procedures. Okay, we have slides. I see someone is writing. I'm sorry, we don't use a lot Teams for communication. In majority of cases, it's other messengers. So probably I don't answer all your questions. And I need to ask Holly in case should I answer for any other questions in case you have. You ask about protocols. Dark fingerings. Okay, you asking for brochures. You know, about all supplements which I can advise, there is no one algorithm for everyone, especially in case of vegetarian patients and in case of undesired vegetarians. Unfortunately, a lot of people, they're lacking of collagen, and please don't forget to remember that and explain it to your patient that skin and subcutaneous tissue, this is always the last in the queue of getting the proteins which your patient and you consume, and always the first in the queue in case body is lacking of the protein. Our body is taking the protein from the skin, the protein from connective tissue, from ligaments, from all over the 3D structure. And this is why we have, after the stress, after the incorrect vegetarian lifestyle, all patients, they have huge problem with the skin, and without amino acid replacement therapy, it wouldn't be possible to restore it. Okay. My dearest colleagues, I thank you a lot. I wouldn't dare to keep you more. And for me, it will be pleasure to clear up all questions which you have in case you collect it in one, because this is crucially important, and this is why patient will continue to follow just you, because you are the best specialist on the market, the best specialists who understand how to work properly with the skin. You know, I always tell to my patients, guys, I have enough patient. I can allow myself to work honestly. And sometimes when even patient come to ask me, I would like Botox, or I would like threads, or I would like this, I would like that, always start with the proper nutrition and then stimulation. Even patients say, oh, it's too long, but I always say that we must follow the rules which nature create for us. It's not my own rules. This is how our cells work. So they must feed them and then stimulate. And amino acid replacement therapy, all these products, these are the best solution for us. I can, for sure, I can provide you my details. This is my mobile. You can WhatsApp me. This is my Instagram, but I'm mostly, working or leading trainings. I'm not very active in social media. I will try to recover this activity shortly. But of course, in case you want to be able to contact me somehow, for any reason, don't hesitate to send your questions to our hosts today. Thank you for invitation, and they will provide questions to me or send it to me directly in direct of Instagram or in WhatsApp. It will be my big honor and big pleasure to exchange with you. Thank you very much. I do appreciate your time and hope to see you soon all around all international congresses. Thank you.